Okay, so we are picking up for lower extremity muscle length, and the first position we're going to do on your page 6 handout is Thomas test position. So I'm going to teach my patient how to get into the Thomas test position, and we're going to have 5 components that we're looking at with this position. 2 of them are going to take goniometric measures, so we're going to take a hip extension measure and a knee flexion measure. The hip extension measure is going to be your iliopsoas measure, and the knee flexion measure is going to be rectus femoris. And you can see on your list here, your 5 components are iliopsoas, rectus, sartorius, TFL, and hip AD and abductors. So with the sartorius, TFL, and hip AB adductors, it's just going to be kind of a visual eyeing, not measuring. But I'll show you what I mean in a minute. So I'm going to teach my patient how to get on the table, and I'm going to spot him as he does so. So, okay, and you're just going to kind of sit on the table a little bit, and you're going to grasp your left leg behind your knee. This isn't for everybody. Obviously, for your geriatric population, you're not going to be doing this, and I'm going to be kind and lower my patient to the table. So you're just going to lay down. Good. Okay. Now this extremity that I'm going to measure should be relaxed out, and he should be adequately holding his lower extremity so that he has no lordosis here and does not have an anterior pelvic tilt. If he does not hold himself adequately, see what happens is that his lumbar lordosis starts to appear, he goes into an anterior pelvic tilt, and his hip extension measure is going to be off. Right now he looks to be normal or long because he's sloped downward, and that's going to come out to a positive number past 0. But if you look, as he, let me zoom in on this, if he pulls, what happens is he flattens out his lordosis here, and that's what we want. We want to stabilize the pelvis so that we can get an adequate hip extension measure. So as long as he's doing that, and I've checked, now I'm going to line up my goniometer. Now I'm going to palpate for the trochanter, right in here, and I'm going to line up my, of course, with my thorax, my stationary arm, my axis is at my trochanter, and my movable arm is in line with his epicondyle. So that's what I'm measuring. Now, if he was, come on, hold on to that. Good, good. I'm checking again, make sure he's not, all right. Going into that anterior pelvic tilt before I decide my measure. All right. So he is at a -3, because if you see, zoom in right there, Shan. If you see, he is not quite to 0. He's a negative number. If he was 0, it would look like this. That would be 0, which is normal. So he's actually short by 3 degrees. And if he were to, and here's the mistake people do, is that they measure, go ahead and relax that other leg out to let that pelvis move. You see, if I follow with my goniometer where his lower extremity went to with his epicondyle and the movable arm, now I'm at a positive 3. So this could be falsely taken if you don't watch that lumbar lordosis and the opposite lower extremity and see if they're doing a good job anchoring that. So I'm going to do that again. So he is definitely a negative, a little short in the iliopsoas. It should be 0, so -3. So now the next one I'm going to do, I'm going to rush down here to the knee. You doing okay, Ange?
Yep.
This sometimes is uncomfortable, so you can lift the leg up, give your patient a rest if they're starting to, get a little bit of hip or low back, discomfort. Make sure you're checking on your patient, okay? I'm going to lower that down. Just relax, 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 relax. Let gravity take over. So gravity's doing the work of the overpressure right now in the hip. But now I'm going to measure the knee. I'm going to measure rectus femoris. The other quads are not involved here because they don't cross the hip joint. So we are stabilizing the hip into extension for that rectus femoris, but the other 3 quads, we would just take a knee flexion measure because they do not cross that joint. So for your, obviously you're at the, axis is at the epicondyles, your stationary arm, again in line with the trochanter, along the femur, and then we are in line with the lateral malleolus. What I have to do is now give him a little overpressure. You doing okay, Ange?
Mm-hmm.
Try to relax. He's definitely going to be short. We should be getting to 90, but we're never going to get there. Definitely not going to get there. You doing okay, Ange?
Mm-hmm.
Can I go a little more?
Yeah, go for it.
Can I go a little more?
Yep.
I'm already getting some resistance here. So I feel like we're getting into a stretch. I'm going to stop right there. He's 60. Okay? So normal is 90. So we didn't quite get to 90. So you see we're at 60. Normal would look like this, which is 90. Okay? So he's definitely short in his rectus femoris. So remember, overpressure, not too much. You don't want to stretch the muscle, but you want to take up the slack of the muscle and tendinous unit. That's the whole idea. So now I want to show you the other three. So Shannon, if you want to come this way. What we're looking at, just look straight on this way. So is he in neutral hip in alignment? Is he abducted or adducted? If he was abducted, he would look like this. If he was adducted, he would look like this. He's not, he's neutral. If he was rotated, and of course, if he's abducted, the abductors are tight. If he's adducted, the adductors are tight. If he was rotated, he would look like this. If he was in external rotation, that would indicate short sartorius. If he was like this, he would be internally rotated, which would indicate tight TFL and IT band as well. So he is not, he is neutral. So none of those things apply. I'm always looking at the tibia. Don't look at the foot. If the tibia is in line, because he looks a little bit inverted at the foot, and that could be looked at as external rotation falsely, so you don't want to do that. You want to look at the tibia and make sure it's in line with the femur. Always looking at the femur and the epicondyles as well to see if it's rotated, but they're not. So, and that is the Thomas test position. So 5 components again. You're doing hip extension, knee flexion, AB, adduction, and your rotations. So I'm going to help my patient to get up. You ready?
Mm-hmm.
Yay. And that's it. You can end it.